So the name of the webinar, 3 ways to end chronic pain, even though you've been trying for years. I'm sure some of you can relate to that. And so I just want to welcome everyone. Thank you so much for joining me. If you're jumping on, I can still see some people slowly coming in. If you're joining me, I'm Lisa Baylor. We're going to get officially started with this. Thank you for coming. This will be somewhat interactive. So you guys seem to have all found the chat box and the comment box. So just if you have questions or if you can't hear me, something like that, just let me know. I can see that, so I'll keep an eye on that. And let me start by formally introducing myself. So I'm a chronic pain and anxiety coach. I am the owner and the creator of the Brain Pain Connection Code program. I'm the founder of the Facebook group Reframe Your Pain. I think some of you are in that group. I'm giving this free webinar today because I healed myself from chronic pain after years and years of suffering. And I've chased down the traditional medical causes and treatments, and they just didn't work for me. So I was trained in conventional medicine. I have been working in the medical field for well over 17 years now. I received my master's and my medical training at Duke University. Prior to that, I did my undergraduate in biopsychology with a very specific emphasis in neuroscience. So that's basically how the brain works. And I've been certified as a mind-body clinician. And I was trained by one of the leading mind-body physicians. So Dr. Howard Schubiner, who was trained by the pioneer of mind-body medicine, which is Dr. John Sarno. And we give a huge credit to him because he brought this concept of using brain science into treating chronic anxiety, pain, and other chronic illnesses. And so I basically want to support people just like you and myself to help change your brain and understand how it's contributing to keeping you in pain, maybe without having to go through more medications, treatments, seeking more doctors. And like I said, I've healed myself from chronic pain. I mean, just years and years of this. So the other thing that makes me a little bit different with some of my colleagues is that I do have a lot of experience in conventional and traditional medicine. So various subspecialties, as I've listed here on my slide, working in neurosurgery. So that means, yes, brain surgery. I actually did that. So I've had lots of spines open on the operating table and people's brains. And the only reason why that matters is because I've seen so many chronic back pain and neck pain patients. And this isn't about treating in that same way, right? But my point is that, they had all these treatments and they were very invasive treatments, and yet they still had pain. And so also I've worked in gastroenterology, and that is looking at the gut and the detoxification systems of our body, and basically, how that is connected to our brain as well. And that can sometimes play a role in chronic pain. And then surgical oncology. So breast cancer patients, prostate cancer patients, brain cancer patients. And I now have a private practice in psychiatry, and I have been able to put all of these subspecialties together and treat mental health patients, but also chronic pain and anxiety patients. And so this is somewhat of a passion of mine, and it was a very long and windy road to get here, but I did get here, and I'm just, again, so happy to share this stuff with you. So, okay, I'm going to request that you guys just focus. So this is a lot of info. I talk really fast. If I'm talking too fast, just let me know. My brain goes a mile a minute. And so sometimes it comes out that way. And so just the multitasking, I want you to pay attention. Turn off the phone, give the kids an iPad. Maybe they need a little Benadryl. I'm just kidding, but some parents, I think, would say, maybe that's not such a joke. And you're here because you want to change your pain, right? So it's super important that you block out all the distractions. Just give yourself this time, put your phone in another room or turn it off. I had to turn mine off, close down the tabs, put on a do not disturb sign, whatever it is. It's just so rare these days that we can give anything our attention, our undivided attention. And so you're here for a reason. And I want to make sure that you get everything you can and focus on the training. So on that note, I do have a gift for you at the end. We all like gifts, right? I know that I do. And so I'm going to share everything about my story. I'm going to share everything about, what you need to know as far as chronic pain. And so it's critical to start changing that now and getting out of that pain cycle today. So if you stay to the end, basically, I'm going to bribe you to stay to the end, and you're going to get this bonus. So basically, it's a few ways that you can start changing your brain. And I'll put that in the chat at the end of the webinar, and it'll give you some pretty good tips on how to just manage some of this stuff. And if you have any questions, you can always reach out to me later. So, promise to you, hopefully the bonus sounds good. And this is what I really kind of want to focus on. So our goal here is to make sure that you get away from the chronic obsession around the pain, right? And I'm going to tell you that even though you think you're missing something, or there's something else to do, or there's something else, or somewhere else to go, that's not necessarily the case. Okay. You're going to discover with what I'm going to tell you that what you've been doing for years doesn't work. And instead, I'm going to tell you and walk you through what does. Imagine just kind of being able to skip over the Googling and the trial and error and just do what works. I know that when I learned the steps that I'm going to share with you, it really changed my life. And it certainly has changed my clients that I work with through the program, but also my patients in the office. So I know that this stuff works, and I know it can work for you too. The biggest thing is I want you to understand that chronic pain is coming from the brain, and it can be changed. That's the last thing on there, but that's probably the most important thing. Okay. And that people have had injuries and pain for years and years and years, and it doesn't mean anything. It doesn't mean it can't change. Okay. So can you relate? I love animals, so you might have to deal with that. I'm assuming that you guys can relate to some of this stuff, right? So you are frustrated. You're going to doctor after doctor. You're going to specialist after specialist. You're trying the newest and latest and greatest treatment, and it's not working, right? And you're probably fed up with medication and side effects. I know I took medications as well, and I had every side effect in the book, and it didn't really help my pain. And so I'm assuming that you're also desperately somewhat trying to seek out a new way to do things. I'm going to share a slide coming up of all the things that I tried, and it's not even an exhaustive list of what I've done, and it didn't really help me, right? The biggest thing is some people always say to me, they stop living their life. They stop doing activities, engaging in, whether it's sports or, leisure activities or things that were just fun because of their pain. And that's frustrating, right? And so you may feel that it might never get better. It's like, I've been here for so long, it's just not working. And you feel maybe some hopelessness there. But it's all hope is not lost, right? Because I know a way that you might not have tried before, and I'm going to share that with you. So if you guys can relate to any of these things, let me know in the chat, even if it's just to make sure that you can still hear me talking. That would be good. And I'm sure you don't know where to start. I feel like, a lot of people are like, well, I feel like I should do this and I feel like I should do that, but I just don't know. Amir, yeah. It's a lot. And so, okay, so we went through what you can relate to. The first thing you got to do though is, yes, Leon. Yes, I get it. Okay, so the first thing you got to do is you got to do this, right? You got to let yourself off the hook. Okay, it's not your fault. I mean, it's not your fault that you can't get results. You're doing the best that you can with what you know. Okay, you're putting faith into things that logically make sense, right? You're listening to professionals, you're treating the symptoms, you're trying alternative methods. And, I'm sure some of you are probably nodding, yes. But the thing is that, what's the famous thing, right? You don't know what you don't know. And so if you're nodding yes in agreement to any of these things, I promise I'm not a stalker. I'm not like, scoping you out on my time off, which is very limited, but it's because I've done all these things, right? I've been there, I've done it, and I've done probably even more things. And so I promise, whatever it is that you're doing and it's not working, it's not your fault. And you didn't ask for this. No one asked to be in pain, right? And so you don't have the medical expertise. You don't have the knowledge to help yourself. So it's really hard to know who the right person is, who to trust. If you feel anything like I did way back when, I would have done anything. I mean, just seriously about anything to get rid of my pain, especially in my neck, and nothing seemed to work. So you have to let yourself off the hook, okay? It's not your fault that you're in pain. But this is where we want to go. So we want to get to a transformation. I love this picture just because I love butterflies, and there is a process. So your chronic pain started at a point, and then it went through a process, right? So it was an acute issue, possibly something happened, and then it created a pattern that got you to now chronic pain. So you're a chronic pain person, right? Now, getting to that point, the way you get out of it is the same way. It's another process, right? So you have to go through the process. And when you're all coiled up and it's tight and it's stuck and you can't seem to move, the thing is, though, if you trust the process, the transformation comes, right? And I just know this because I've done it. And you're going to hear me say this 1,000 times throughout this webinar, but I just want you to know I get it. Okay. And so in the end, if you go through the process, you didn't get in chronic pain in a day, right? It took a long time, and it's going to take some time to get there, but it doesn't matter how long you've been there. Okay. So it's more of a picture of hope that your wings are going to fly and we can do this because I've done it. And I didn't think that you could. So when you fix your pain, tell me in the comments once you read this over, which one you want more. For me, the thing is when you fix your pain, let me go back. I'll take it more specifically to me. So, I sleep better, right? Because if you're not in pain, you sleep better. If you sleep better, your mood is better. If your mood is better, then you stop worrying about everything because you're not frustrated and upset with being in pain all day, right? With that comes more gratitude. You wake up and be like, oh, I can actually do something with my day. I can actually go and have fun instead of being constantly bombarded with just stress and anxiety over my pain, right? So the thing that's really cool about this is that, you get to a point where that transformation starts to happen, and it is over time, but, at one point along that continuum, you do kind of realize it. You're like, oh, I didn't have pain today, or, oh, it was less. And that's part of it, right? And that's the whole beauty of the transformation. And I'm sure, I don't know if you guys have heard that story where you can't push the transformation along, right? It's kind of have to organically happen, but you do need to have steps. Like you need to know exactly like which way you're going. Just like with the butterfly. I mean, it just naturally happens because it knows that's what it's supposed to do. But if you push it too hard, it's just not going to work, right? So when you start working on things in a certain way with the right kind of help and guidance, then that's going to benefit you getting to that place faster. So then the other cool thing about this is that you get to start working on other areas of your life. So, people that are overweight, or they've got diabetes, or they've got all these other issues or whatever, all those things start to get better because you have more time to start working on your health, like in a holistic perspective, because you're not dealing with pain all the time. And then the best thing is after you go through some of those steps, you start to actually learn to trust your body again, right? Start to feel empowered, and you start to remember, oh, I used to be this person. So tell me in the comments, which one of these do you want most? I mean, I want them all. I always want all of them. I never want, it's like going to the ice cream place, right? It's like, I mean, really, I'm supposed to choose just one flavor? That's just cruel. So which one is best for you guys? Tell me I want to know. I would say, yeah, see, I want them all. I'm just being honest. Normal day without pain. Yeah. Yeah, that would be nice, right? So, okay. So I love this, right? This is a good sentence. All success is predicated on you making a decision. So there I was, defeated, desperate, pretty frustrated, decided, you know what, no more. I want to tell you a little story about how I got there, though. Yes, Leon, I want the old me back. Yes, 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 yes. I know that feeling. So I went in, I was seeing a chiropractor. Now remember, I told you, I was in neurosurgery, right? You don't go to the chiropractor when you work in neurosurgery. Well, I was desperate. I was completely desperate, at my wit's end. And I just said, well, what do I have to lose at this point? Right. So I went into the chiropractor. Now, mind you, I was going to a very specific kind of chiropractor, and she didn't do traditional manipulation, but she still did it. And I wasn't really feeling better. And I went in one day, I was going like twice a week at that point, maybe. And she just said to me, "You're just not holding it." And I'm quoting it because I will never forget that day. And she said, "You're just not holding it." And I thought, I'm not holding the adjustment. And so that was what she said. And she's like, well, yeah. And I just thought to myself, my brain just clicked on and just said, well, what am I supposed to do? Like, if stress is causing my muscles to tighten and I can't really control the stress right now, that was a really bad time, by the way. So like stress was just out of control. It's like, what am I supposed to do? Come in 3 times a week? Not only is that not sustainable, financially doable, like that completely is absurd, right? And look, this chiropractor was good. The physical therapist I saw was good. I was the one writing the physical therapy prescriptions. Remember, like I could tell you like how you write them out. Physical therapy, evaluate and treat 2 to 3 times a week for 6 weeks. Now, did I ever extend those prescriptions beyond 6 weeks? Yeah, sometimes, but most of the time, no, you don't. Do you know how long I was in physical therapy for? Just take a guess. Take a guess. How long I was in physical therapy. I was in physical therapy, I'll just tell you. I was over 2 years. Over 2 years. I have never once written a prescription when I was working in that practice for physical therapy more than 2 months. Okay. More than I would say 3 months. That'd be fair. 3 months. 2 years. Okay, 2 years. So that's beyond absurd, right? So I decided at that point, I'm going to figure out how to stop. Yeah, 2 years, Jackie. How to stop fighting against myself. And it didn't matter how long it took me. I was going to do it, right? So I made the decision, just like this slide is saying, I made the decision that I'm going to figure out how to change my mind-body connection. And that's when I started the journey that got me to where I am today, being here with you guys, sharing my story, my methodology with you guys, my clients, my patients, so that you can skip over all of the crap, trial and error, and get through the struggle, because I did it. Okay. So at that decision led me to figure out, sorry, I'm trying to read the chat too. That decision led me to figure out that what I'd been doing all of those years was just almost completely wrong. So you're going to hear me talk about this more and more, right? Looking back, despite the utter misery that I was in, I have to say I'm very grateful. So remember that slide? I'm now grateful because I made that decision to take my control back. I invested in myself. I would probably still be trying the newest thing or some other invasive procedure, get another adjustment that wasn't really working, and not getting anywhere. So like so many people said, I've said it before, when you know better, you do better. And I want to validate the struggle is real. Okay. This is probably like my favorite slide, because even though I am now able to sit here and I'm having most of my days without pain, it took me years to figure all this out. I had to unlearn every single thing that I was taught. Okay. Everything that I thought was the right thing to do, because I had to quickly discover how wrong it was. And remember, I was trained a certain way, right? And so I had to test out different methods, different formulas to see which one worked for me. And I really struggled through this. This was difficult, right? Because I'm in pain, I'm miserable, I'm pissed off, and I have anxiety. And the thing is like, I'm going everywhere, and it was just making everything worse. So looking back, I wish that someone was able to tell me what to do without having to spend time, money, plenty of tears and energy trying to figure it out. I felt like, I was on the right track for a little while. I really did, but then I realized I wasn't. And I remember one story, I'll tell another story. I love stories. And you can tell I use my hands all the time. I come from an Italian family. It's just kind of how it is. And so what happened was I was in my physical therapy office with my physical therapist, right? And I remember bringing up to him, look, I want to change our approach. And I am very interactive in my treatment. So I do this with my clients and I help them guide, their treatment if they're already in it, or I do that with even my patients, right? We try to get, a collaborative approach. I think that's the best way to heal. You need a village kind of thing, right? And so I remember going in and I told him, look, I think there's a nerve component. Like I have this nerve pain and this is what it is. And he got so excited because I guess he came back from some conference that he was in, and it was all about how the nerves innervate the muscles. And if you get to the nerve, then the muscles will release. And it was this whole new way of doing physical therapy, right? Instead of like the digging into the muscles and like trying to release the trigger points and just sometimes somewhat almost invasive and counterproductive therapies. So he was excited and he said, okay, yeah, let's do it. Right. And it was good timing because, you know, he just got back from this conference and he was talking about the nerves and this fascia. So fascia is a very fibrous kind of tissue. It's very tight connection that keeps things together in the body. Right. And so he was trying to learn this new technique around that. And I'm like, hey, let's do it. I'm up for anything at this point, right? And I thought, this makes sense, right? This will work. And I'll tell you what, it did. It did work. It helped a little longer than the other one, but it came back. My pain came back. I was just as miserable. And then I was just back to square one. So the reason is because he wasn't getting to the root of the problem. So it took a lot of time, but it took a lot of patience. There was no way that I could have arrived at the brain pain connection without having invested in my own professional education, becoming an expert in mind, body medicine, and brain science, and advocating for myself. But again, I told you, I was committed. I was committed to figuring it out, and I was not going to go back to the old way of looking things. So let's go over the old way, my old way. So this is the before I got out of my chronic pain. This is ridiculous. Look at this. Okay, this is my picture, right? I mean, look at this stuff. Like, you guys, this is crazy, right? I mean, how many of you have used any of this stuff? I mean, foam rollers, resistant bands. I bought a TENS unit. I was doing yoga. I was doing all this stuff. I mean, what have you guys done, right? Just tell me, what are all the things that you guys have tried? I mean, just be vulnerable here, right? I mean, just be vulnerable. Like, I mean, creams, lotions, potions, you name it. I did it all, right? Before brain pain recoding that I did, right, on my own, you could find me hanging over the ends of the couch. Sorry, I'm hitting my tree. Ends of the couch, stretching my rib cage because that's what the physical therapist told me to do. On the floor with my dog, on those yoga, you know, the foam blocks, right? My head hanging off of the edge of the bed with my hands, you know, at the base of my skull because I was trying to, you know, adjust my cervical spine. I mean, remember, right? I did this for a living. So, I mean, seriously, you guys, I was like a one-woman circus at any point in any day, right? Trying everything. I mean, this just doesn't even show you maybe a third of the stuff that I did. So, I mean, if anything, just make me feel better. Can you tell me something that you guys tried? Because if it's just me that did all this stuff, like, I'm just going to be like, oh man. So just tell me something that you've tried. Tell me whatever it is. Okay. But like, this is the before, right? I mean, we do all this stuff. Yes. Heat, ice, bands. Yes. Oh gosh, the heat. I forgot that. I had the heat thing around my neck. Right. The creams and the stretch stuff. Oh yeah, I bought all kinds of fancy things. I'm going to go into that though later. Okay, so now the next picture, okay, should probably be the after. It's going to be the after picture, but it's really the before. Okay, so it's the before this picture. You'll see what I mean. Okay, so I am a huge yoga person. Okay, I love yoga. I feel like everyone in their whole, like everyone in the world should do yoga. I feel like a guinea pig with people to cure when it got too difficult. Yes, it's so true, Leon. Like, I totally feel you. And I was there. I was right there in the little cage with you, running around on the wheel. So absolutely. So the reason why I put this here, this picture is called Pinchi Mayurasana, and it is a very advanced yoga pose. Do not attempt to do this at home. Please do not. But the reason why I put this here is because what I discovered is that through all the trial and error, that it wasn't that I had a messed up body. Okay. I kept hearing, oh, you know, your muscles are too tight. So let's dig in and get those trigger points out, right? My pelvis was tilted just at the right angle that it was pushing everything else forward, or my abs were weak. That was my famous line. Well, my favorite from their famous line of my abs were weak. I'll tell you right now, you cannot do this pose if you have weak abs. It's impossible. You can't even get halfway there if you have weak abs. I did not have weak abs, but that's what everybody would tell me. Everybody told me go to therapy. Everyone told me to do more therapy. Everybody told me, you know, I got to realign this and fix my glutes and work on the piriformis muscle. I mean, I can tell you, and there's a whole list. What I discovered is that all of those things, whether I had a trigger point, whether I had one leg shorter than the other, whether I had whatever, all those things that were being labeled as abnormal were in fact very, very normal. And they had nothing, absolutely nothing. Hear me say it again. They had nothing to do with my pain. Okay. None of that was helpful. It just made everything worse because in my mind, I'm thinking I'm missing something, just like I said earlier on that slide, right? You think you're missing something. No, 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 and no, right? I was finally able to let myself off the hook, like I told you guys in the beginning, right? And figured out that in fact, I had a brain wiring problem. Once I started to address why my pain was showing up in my body, everything changed for me. And I'm going to show you and share with you how I did that. So you can just skip over all of this craziness, right? Because there's a simpler way to do it. So now this is the true after. So I was able to get back to this after, but this is what I was doing before my chronic pain in that previous slide. Okay, so here's what you're doing. I'm going to guess. Tell me if I'm wrong. And I'm going to give you my rebuttals. So you're going to doctor, and sorry, my eyes are trying to read this slide. It's a little different on my end, but you're going doctor to doctor, right? Specialist, specialist, surgeon, surgeon. And the thing is that you're given a reason or a diagnosis that's causing your pain. Okay. So here's the first concept. This thing with the webinar title is 3 things, right? So number one is what you think you're supposed to do is not what you're supposed to do for chronic pain. Okay. So going back to this first point on the slide. Okay. The thing is, doctors and physical therapists and most clinicians are not taught how to effectively treat chronic pain. Okay. Acute injury. Yes. That's why you go to the ER. You break your arm, fall down, whatever, you go to the ER. That's what they're there for. The problem is that they learn to treat the symptom, not get to the root, which is the brain. Okay. It's a brain problem. It's not a body problem. Chronic pain is a brain problem. So the second point, trying new medications, adding medications, right? Okay. Here's my rebuttal to that. This may be a temporary fix, right? Remember, I deal with meds all day long, right? So there's a clinical reasoning why that may work and it may temporarily help, just like opioids. But now there's also a reason why we're in an opioid crisis, right? Because they're just treating the symptom. They're not getting to the root cause. And the thing is when you give medications, it changes the chemistry of the brain. So of course you're going to get an effect from that. But the problem is that by doing so, you're actually keeping yourself in pain because it's reinforcing the belief that something is wrong in the body and it's not addressing the root cause of the brain. Okay. So the third thing, you're buying all those countless crazy gadgets and rollers and whatever. Oh yeah, the inversion table. I forgot that one. I had one of those too. So here's my thought on that. Do some of those things work? Yes. Why? You know, those tingly gels and everything. I think Jackie mentioned that she had some of those creams and whatever it was. So the reason why they work is because it creates a new sensation in the brain. So changing the brain pain wiring, right? Some things like deep massage balls, those inversion tables, they can actually cause harm, right? And create things in the spine or in the tissues, like the trigger points, that actually can do damage and cause other problems down the road, right? And then you got another list of things to deal with. So you have to be careful with that. I don't think they're all bad, right? But you got to be careful. So final point, you stop doing the activities. We talked about that earlier. You're not doing the things that you want to do. So you're saying, well, I can't do it anymore, right? I can't do it because I'm in pain. And I understand that it may seem like that, but people just assume it. They just assume that that's the case because you're used to doing it, right? You're used to doing it. I did it too. But if I sit here, if I were to tell you, if I sit here, like if I had coffee, so Leo, maybe you're having coffee right now because it's your morning. If you take that and you focus on the smell of the coffee and the taste of the coffee, the warmth in the mouth going down into your chest, if you're actually putting your attention on that, focus on that, and you have pain, you can't be in pain because your brain can't do both. It can't do both. So even if you take the pain away for a millisecond, because that's where the pain's coming from, it's coming from the brain. So you're able to focus on the coffee and the other part goes somewhere else, right? Even if it's temporary, but it does. So clinically speaking, it's possible. I have yet to find somebody that they say they're in 24/7 pain, but it's not true, right? It's not true. Try it. I want you to try it and then email me and tell me if it works. Okay, so those are my rebuttals. I hear this all the time. Next one. We're going to talk about the root cause of pain. Okay, so concept number 2. I hope you guys are writing this down. You're going to get a quiz. Understand and accept the root cause of chronic pain. Okay, what that is the brain. Look, pain is a human condition. We're supposed to have it. We need it, right? But chronic pain is not. That is something that has roots in the body, in the mind, the history of our lives, and the spirit. If you believe in that, we have roots. And those, it's like a tree has roots, and then it's like there's another tree and those roots, and it's like there's just a whole thing of trees, right? With all these roots. And the other thing is we also have roots of emotional things: loneliness, resentment, fear, anger, being perfect all the time. These things have their roots too, and they kind of attach on to other roots, and it just grows, and it just keeps you deeper into this state, right? So getting to those roots of our physical pain is going to set you free from it. I did it. I know it's true. And anyone can argue with me, but I will just keep arguing all day long because I know it's true. So look, I can get a headache, I can get a neck ache, but I cannot freak out about it anymore, right? I have the ability to control my anxiety around my pain. I can control my pain. I can calm it down. Sometimes I just make it totally go away. I mean, it almost sounds like magic, but it's not. It's brain science. It's science, okay? It's neuroscience, neuroplasticity. We'll get into that later. And so now I can do the things that I used to do. I mean, I go for a walk. I can, go back to yoga. I can just do things that I was able to do before that I was so afraid of doing because I was in pain all the time. But once you realize the pain is coming from your brain, then you're not going to be in that state of fear. You're not going to be in the state of stress. Stress causes more fear. If you're in fear, your brain is going to try to protect you. So think about it, right? This is really simple. Take your hand, don't do it. Imagine taking your hand, putting it on a hot coiled stove. I mean, you're gonna pull it away, right? Do you really think the next time you see the red glaring thing, you're gonna just go put your hand on it? Oh no, of course not, because your brain coded for that's danger, don't ever do that again, right? So when you see it, you may not notice that you're having fear, but it's there because it coded for it. And it's the exact same thing with pain. It codes for fear that you may not be aware of so that it protects you down the line. It's just trying to do its job. Okay. I'm hoping that makes a little bit of sense. But basically your body, this last sentence, your body creates this pain response to keep you safe. That can be from a previous injury, an expectation of an injury. Remember the hot stove thing, or it can be an emotional injury. So root cause of pain. What is it? Put it in the chat. What is it? What's the root cause of pain? Please get this right. You guys have to get this right. What's the root cause of pain? It's coming from where? It's coming from the brain. Okay. Yes, your brain. Okay, so concept number 3. You have to debunk, right? Get rid of the misconceptions about pain. So here's this. I'm going to go over this. This is what I hear all day long, right? I have a scan. So did I. Personally, I did too. I had a scan. It shows some abnormality. I've got a disc issue, right? The doctors say I have this. I have to go to physical therapy. Look, it's physical. I could see it right there. Well, you have to believe, number one, you have to believe that your pain is coming from the brain. And if it wasn't, Leon, I'm trying to read your plasticity of the brain is amazing. Yes, exactly. Yes, neuroplasticity. Exactly. It's a real thing. And so, you have to believe your pain's coming from the brain, right? And if it wasn't, then why do you still have pain after treatment, after medication, after procedure, after whatever, surgery, right? I mean, come on, that doesn't make any sense. That doesn't make any sense, right? It's because your brain decided to code for something that has put you back into that fear state. So number 2, people say, well, the only way to stop the pain is if I take medication. Well, we already went over that, right? Medication has its place, and it's never, ever, I'm never going to recommend anyone to just stop medicine without your doctor's approval. Please don't do that. But you have to accept the reason why it's working is, like I said before, is that it's changing the brain chemistry. You're not necessarily addressing the issue in the body, but you're changing the perception of it in your brain. Okay, so yeah, sure, it works. And medicines are great. I think there's a place, we need them, but not with chronic pain. Sometimes it actually doesn't really help. This one is another favorite. Makes sense. Makes you like a zombie. Yes. Oh yeah. I was totally out of it. I mean, I couldn't function for like 24 hours sometimes. And I was just like, I can't do this. I got to go to work. Right. And people have kids and families. I mean, that's just no. And so this one, everyone in my family, right? I hear like, oh, we're just anxious. We're nervous Nellies. We all have back problems. We all have knee problems. We all have these kind of things. Right. And so no, because in what I teach people is something called epigenetics, right? Epigenetics is basically just a fancy term where I like to say your genes do not determine your fate. And think about this, right? I can prove this one too. So I worked with breast cancer patients. So think about this. They would come in to see us for family history of breast cancer, right? So mom, sisters, maternal aunts, grandmothers, right? All breast cancer. So this person would come in for surveillance, but yet they never got breast cancer. I mean, we followed them for decades. And so why is that? So if it's genetic, then why didn't they get breast cancer? Because there's more to life than just your genes, right? Just because something is common in your family doesn't mean that it's going to be for you. You can change the fate of your expression of your genes, right? So this applies to pain, okay? Just because someone else has bad knees and a bad back in your family doesn't matter. Doesn't matter. It's not true. Doesn't mean it has to be you. Okay, the second one. I go to physical therapy and I get relief, or the product, whatever, gets better. That was me. Like I said, I got better for a little while, but the thing is that you got to change the brain pattern, right? And I'm not saying you shouldn't go to physical therapy or do those things. I think they can be helpful. They can, but if you go into them knowing that you're feeling safe and that it's not going to fix the problem, it's just going to help you get to the point where you fix the problem, that's a different approach. So again, it's how you're looking at things, right? And then the final one I love, everyone's like, oh, so I must be crazy because everyone thinks my pain is all in my head. Well, I don't know how to say this, but literally, yeah, it kind of is, because your brain is in your head. So other than that, no, you're not crazy. The pain is completely real. It is completely stemming from your brain and it's being felt in your body. It's the brain pathways that are telling your body to experience that pain from a previous or even very well healed injury or an emotional cause as a way to protect you. Okay. So think about it. Pain is coming from neurocircuits gone bad, right? Or tissue damage. I mean, yeah, if I take a knife and I stab my hand, that's going to cause pain. But again, the sensations are coming from your brain. So again, that's the big concept here. Okay, let's move on. So what does work? You got to get rid of the danger signal, right? You got to get rid of that fear state. It's like the fire alarm, the smoke alarm goes off in your house. You know, you're lighting candles and you blow them out and it thinks it's, you know, there's a fire. Not good, but that's what's happening in your brain. So it's just mismatched. It's thinking that the smoke from the candle is like a fire in the house. No, but it's all wired wrong, right? So you got to disarm the danger signal, disarm the alarm. You got to change your response to fear. Remember, everything that is associated with fear, either consciously or unconsciously, is going to cause pain because your brain coded for it somewhere along the way, wherever your roots are. That's where it happened, right? Perfectionism will keep you stuck. I am totally guilty of this. I have to do everything right. This whole webinar is not right, but like, look how far I've come. I'm actually laughing about my mistakes and it's okay. And you guys have to get there too. You got to change that mental chatter, right? I think that's the biggest thing that takes us down and it keeps us in that fear state. It keeps us in that stress mode and it's just not going to help us. So also moving through the past, someone said it better than me. You gotta, better than I did. You move past the past, right? Because there's things that we carry that we're not always aware of that will cause chronic pain. And the body, there's a famous book called The Body Keeps the Score. And it's a little clinical, I think, for the masses. But at the same time, it's very good because it talks about how our bodies code for little traumas that maybe we're not even aware of. And then it creates that pain cycle. So then when there's a stressor or another stressor and they're coming from whatever, over time, collectively, now you have a huge pain cycle and you're not even aware of it. So rediscovering who you really are is another thing that works, right? Because you forgot, like Leon said, right? I want my old self back. you actually said it right here in the chat. So you got to get back to your roots, right? What are those roots? The good ones, right? And what makes you you? Finding gratitude and hope again, right? Finding the little sparks of joy. You can still be miserable, but you got to at least see the sparks of joy. And I know that personally, right? I can be completely miserable, sad, in pain, whatever's going on, but I can still now, I can find that space to just say, okay, well, you know what though, this coffee, remember, the coffee is so good. This is just such a great taste. Or the smell of lavender, essential oil that I just put on my skin or whatever. You got to find something to train your brain. Leon used to be the life of the party. Well, we have to work on that. We got to work on that. And then learning how to calm down the nervous system. That's the biggest thing ever, because what do you think the nervous system is, right? It's all the brain. Okay, so this is what works. This is how we get out of pain. Now, my discovery, the thing is I didn't have any of this stuff right at my disposal. I had to pull from all these different places and all these different people. And it was exhausting, honestly, to tell you. But you need to have kind of a method, right? You got to have a plan. You have to have a step-by-step thing that puts things in place for you, heals, fixes, addresses the root cause, so that you can stop doing all of those things that don't work. And then you can focus on the key elements that we just talked about, right? Focus on these instead of all the things that aren't working. And so basically I had to, I created this because I had to systematically, like my brain is very analytical. And so I like to have schedules and I like to have structure. And, if I don't understand it in that way, then I can't do anything about it. And so I had to put like, what are the things I needed? And I love this picture because it shows these deep, deep roots, right? And it's the tree. And so you have to understand, remember the root, right? Where's the pain coming from? It's coming from your brain. You got to have a step-by-step guide. You have to know how to address your nervous system. You have to know why you should do it. Right? You have to start challenging things and questioning the pain a little bit. You also need somebody to kind of hold your hand, right? Professional that gets it, someone that's done it, someone that's been there, right? And you have to also, in my private practice, I pride myself on people come to me after seeing, a million different people and doctors, because not only do I see things differently, but I've also been there and done that, right? But I've also applied personalized treatments because we're all different. We all come from different backgrounds. We all have different, stories to tell. We have different traumas. We have different ethnicities. We have different cultures, and all those things matter. And you would not believe how much that plays a role in each person's chronic pain journey. So you have to be able to get some clarity around that. And then you need to be accountable for changing it. You need to show up, you got to do the work, and you need someone that might push you a little bit. And I'm sure you can tell I might be someone that could do that, right? But you got to be able to have questions available and answers and options and, emotional support, right? So you got to have that stuff. I didn't have any of this, but these things are essential. You have to have these, because if you don't, you're going to be going doctor, 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 like you do. Just like I saw someone today in my private practice, we're doing brain pain coaching, and oh my gosh, the stories I can tell. Could you help with all the items? Yes, we're going to get there, Amir. I'm going to get there. So let's just review. Okay. I'm going to drill this in your brain. So the three main things. Number one, pain is coming from the brain. Okay. It's not coming from the body. Physical symptoms do not relate to damage in the body. If you are a part of my Facebook group, I put a table in there that shows, all these people that have disc issues on imaging, but yet they don't have any pain. Well, how do you explain that? It's because pain is a construct of the brain, right? And then the last thing, you address the nervous system, you're gonna get pain relief. It's actually very simple. Okay, so here's one of my favorite slides. So this is probably you. This was me, but this is probably you, right? Going the wrong way, dead end, U-turn, sorry, road closed. I'm not seeing slides. Let me see, Leon. Do I adjust? I'm not sure. Is everyone else seeing this slide? You can see them. Okay. I'm not sure. If you have to log out and log back in, Leon, then that's okay. We'll be here. No problem. We can just do that. So this slide here is basically, all the things that you've been doing, right? And you show You show up, you're frustrated, you're getting a little hopeless and miserable. You're feeling like your confidence is just going down, and you're just like, I'm just tired. I'm tired and I'm just over this. And I just feel like everything I do is leading me to a dead end. This was me. I totally felt like this. And, remember, I'm trained, right? So I have the medical background and I'm like, but what about this and this and this and this? And it was just exhausting. And, when you feel like that, it's not easy. It's not easy to help yourself. And it's not easy to get yourself to a place that you even want to stay motivated to find another answer, because it's hard, right? And so I'm assuming you guys showed up today because you probably feel a little bit like this, right? Kind of like that first couple slide or whatever I put on there, where the little dog with the hand, where you can relate. I mean, it's not a straight line, and you're trying the best that you can. You got to let yourself off the hook. And I'm assuming you want a simpler method. I'm assuming you want a little more guidance. I'm assuming you want some more education. Leon, make sure the chat box is clear. Yeah, thank you guys for trying to help her. Okay, so yes, roadblocks. Very, very frustrating, right? So I'm going to talk a little bit about my journey. Okay, so it's kind of simple, right? What's the whole saying, 1,000 steps starts with one, or whatever it is. The thing is you got to start somewhere, whether it's emotional, mental, physical. You just got to pick a place. But the first place you got to start is you got to say, I'm ready, kind of like in my emails, right? Are you ready? Are you ready to change it and do something different and open your mind? During my pain journey, I did all the things that most of you guys have done. I went to doctors. I remember, again, I was conventionally trained in medicine. So I was taught, if my leg hurts, it must be a problem in my leg, right? If I had a headache, it must be something going on there, like I'm dehydrated. That's possible. But my point is, I went from doing yoga, that picture, 5 days a week, living a normal but very stressed out life. I was in surgery. I was on call. I was not having proper boundaries with my friends, families, colleague. It got to a point only after years and years of struggling with various medical illnesses that I never had before, that I became a chronic pain patient. I was afraid to go for a walk. Like I said, I feel guilty to this day. I didn't even want to take my dog for a walk because I just was like, I was in so much misery. How horrible is that, right? I changed my specialty, my entire work life. I changed my whole life, and I did that to work around my pain. That just sucks, right? I mean, there's no other way to say that. That sucks. And I'm sure you guys can relate to that. And I don't want you to have to keep doing that. So I started having anxiety about all this, right? I mean, it was interfering with my sleep. Like I said, I wasn't sleeping well. So then I woke up in a bad mood. I wasn't grateful for anything. I mean, I was just pissed off all the time because I was just miserable, and I was afraid of not knowing like how my pain was going to go that day. And I couldn't do anything that I set up to do. Then I had a huge emotional event. My dad died, just gone, right? It was such a huge trauma emotionally that added on top of my existing stressors. This catapulted me into even more pain. I thought my pain was bad at that point. Before that, this got even worse. It took a toll on my work, my family. I mean, everything. It was just too much. It was just too much. And so, oh, good, Leon, I'm glad. I want you to hear this story. So, after that, I was at my limit. That's when I started going to the physical therapist. I started going to the chiropractor that I vowed I would never go to. I saw pain management. I tried medication. All of them had horrible side effects. Like I said, I couldn't tolerate any of them. I bought all the crazy stuff on that picture you already saw. And I was honestly thinking, like, I had a nerve issue. I had all the scans. And the last scan that I did, it was an MRI. Last scan actually showed a disc bulge, right? It was in the distribution of where my pain was. Remember, I can read this stuff, right? I can read my own scan. And I'm looking at it being like, oh, that's L4, L5, L5S1. And I can tell you it was exactly where my pain was in my leg. At that time, it was in my back. And it had moved. And so I'm thinking, oh, this makes sense. Of course it does, right? This is what this is. So I guess what I did, probably what some of you have done. I had a nerve block, right? Underwent an epidural. That was the most excruciating thing I've ever experienced, right? Physically. And it made sense to me though at the time, because again, this is how I'm trained and I'm still in that space, right? So after all that, getting zero relief, if not making it worse. I mean, I just said, that's it. I'm done. I started looking more into the mind-body medicine. I went back to my roots, right? My roots of biopsychosocial perspective, meaning biology, psychology, sociology, functional medicine, understanding trauma and how that affects and creates physical illnesses and issues in the body. Those were my roots. And once I went back to my roots and what I was really passionate about and convinced, and bringing up my neuroscience background, that's when I started to heal. So at the beginning, I told you I was going to do this, right? I wanted to teach you guys these things. So now here's the thing I want you to remember. Everything that I've shared with you today isn't some random theory, and it's not some idea that I think might work for you. Everything I've walked you through today is because it's science, it's brain science, and I've studied this in many different forms. I have been a patient. I've been that person. It worked for me. It's worked for my clients. It's worked for my patients. And I'm pretty sure it's going to work for you too. I'm not super special. It's not like this is some new theory. It's just people don't know how to apply it, right? They don't know how to do it. And the thing is, you know, I get it. We're all busy. We have families, carpools, and animals, and whatever else we do. And the thing, I mean, you got to remember what I just said. I mean, I was working, I had a death in the family. I, you know, was on medication. I had stressors, you know, at home. I was on call. I wasn't sleeping. If I can do that, you guys can do that. And I already know that, you know, you're halfway here, right? You already know you can achieve a pain-free state as long as you have accountability, you have a plan. And like I said, where you are now, because you've been in this webinar, like you are farther along than I was after years of this. Okay. So you now have a choice. If this were my choice, I'd probably just take the sign down and run towards the mountains. But, you know, I'm a little bit of a rebel. So the thing is you can continue to do what you're doing. Ultimately, you know, I don't know. It's not going to work because it's probably not working already. You can go to the University of Google. I love to say this to everybody. University of Google is not an accredited school. Okay. It's not. It's just not. You can do all the self-help books. Actually, I'll lend you mine. I've got hundreds and hundreds of them, and they're good. I think you should read them. I love them, right? But finding a new therapist isn't going to do it. You're going to do all this stuff and keep trying something new, hoping that it works. And it's just not, right? Even though it's never worked before, you're thinking maybe it'll work again, but you can also choose a simpler path, right? And so my job here is to educate you. I want to provide this information to you. I want to make sure you have the right information so that you can end the struggle. And I also want to give you that free gift at the end too. So thanks for sticking in there with me, you guys. So I want to introduce you. I talked to you in the beginning about my formal introduction. So I own and I created the Brain Pain Connection Code. What this is basically a system of how you get out of chronic pain. I took those 5 things that I mentioned earlier, right? And I put them into a program, and I put them into a very specified way of doing things that includes education, but then techniques and you know, methodology that you've got to know how to do in just the right way in order to start recoding your brain, right? And so I know that when I was trying to find this stuff, I had to just get it from all these different sources. And so that was just frustrating and annoying, and it took me years. So the thing about the Brain Pain Connection Code is that it's kind of my creation of, you know, what came out of my own chronic pain journey. And so it's a way that I can help other people do it. And people ask me about this all the time. And so I always tell them the best way for me to talk about this is one-on-one. I like to personalize. It's like Leon, like I'm so excited that you're here. I like to personalize this stuff. And you're gonna learn how to get to the root cause of your pain, right? You're gonna learn how to start treating it. You're going to get professional help around doing it, that accountability we talked about. And I honestly, just like Leon said, let's just like bring you back into life a little bit, right? So discovery call. This is how I do it. I just tell people, look, it's a free call. This is not charged at all. Brain Pain Connection Code program. I go over it, but really what the discovery call is, I want to learn more about you. You guys have an opportunity to see me. You've got to spend some time with me, and you see a little bit of my personality. You know my history. You know my background. You clearly know that I get this. And so the thing is, but I don't know that about you. And I'll tell you, in my private practice, this is exactly how every single person gets into my practice. Now, I don't have my medical assistant call. I don't have a secretary call. I don't have the front office or my back office staff do this. I call every single potential new patient. Yes, that takes up a lot of my time, but it's very important for me because I want to make sure that I know that I can help you. Okay. So I want to get some clarity around what's going on, what your issue is, what's happening. And then I also want to know like what you've done, right? Because it may not be a brain pain problem. It most likely is, but it may not be. And so I want to be able to set you straight and get you clarity around whether or not it is. Okay. And so sometimes too, there's some self-sabotage happening, right? Remember I talked about, I got to do everything this way, or I don't have the worthiness that I deserve to feel better. And you know that here that you do, but maybe somewhere else you don't. And so I want to clear those up as well. And if there's anything standing in your way of getting out of chronic pain, I want to know about that too, right? And I might be able to lend some insight for you because I think that's another key factor. So the thing is that we want to be able to, I want to be able to offer direction. If we feel like it's a good fit for you, then we will go and move on with that. If you're not going to be patient and kind with yourself, if you're not going to let yourself off the hook, like I mentioned in the beginning, right? If you're not able to just look at a new way of doing things, right? Be interested in the health and well-being, right? You got to be able to do that stuff. And I know that's sometimes some of the hardest things to do because we just make ourselves so responsible, but then that just makes us more stressed out. So if you are someone that wants the support and the accountability, and you can sidestep all of those obstacles like I, went through, let's schedule a call, because I don't have a call center, by the way. This is just me. So that's why I'm giving you my link, right? My schedule, because it's easier for me to just do that in between my other stuff in my day job, outside of my coaching. And so if you've tried a million things, you've been given a diagnosis, you're on medication, you're working with a therapist, everything is just going, it's not getting any better. I can tell you, I know this stuff works, right? It's based on epigenetics. We talked about neuroscience principles. We talked about the neuroplasticity, like Leon mentioned. And the thing is that I bring all of these things together, right? So attachment, trauma theory from psychological models. I mean, we bring it all in because all that stuff matters. And so, only an expert really can help because there's just so many factors involved, right? And the traditional medicine ways and approaches and programs, they don't cover this. They don't cover things like I want to know, like I want to get to, and the thing is you get access, right? You get access to me. And I want to know your mindset. I want to know your environment. I want to know your social setting, right? We don't exist in a vacuum, right? Traditional conventional model, they don't look at this stuff. They should, but they don't. So there's a very big difference between trying to figure it out on your own, like I did, and I was medically trained. So I mean, just think about that, you guys, like think about that. It took me so long because I was looking at it from the wrong perspective. And so let's do your bonus. I am so grateful for you guys attending this as promised. I am going to put the bonus in here. This is going to be, it says 4. No, it says 5. I think it used to say 4. I think I added 1. So you guys get something even bonus on top of the bonus. It is my gift to you. I will put this link in the chat as well. And you can either just click on it and it should open into a PDF. If it doesn't, and it doesn't start downloading, just let me know. Just email me and I'll send it over to you because that's easy and no big deal. So I just appreciate you guys all coming. I want to give some time. I can't believe I actually did this under an hour for some questions. I have some questions that came through earlier. Okay, good. It opened. That's great, Jackie. Thank you. The number one thing I get is, what if I'm working with another practitioner? That's fine. That's great. Actually, I can probably help with that because a lot of those people don't understand how this works, right? And so we want to make sure that if you are working with another provider or a practitioner, that they understand that you're doing some mind body work and what that means and how they should approach it, right? Because we don't want to induce more pain. We don't want to induce more pain pathways. And so I want to make sure that, and the thing is that here's the goal. The goal is that we educate, right? We want this out. We want this way of treating outside of the conventional model. I want everybody in the world to know about this stuff, right? So if that means even through you get to educate your provider and say, hey, look, there's this thing I'm working on and it seems like it's helping. And I kind of want you to, approach it that way. Because I was that patient, remember, where I went to these doctors and they would just flat out deny that there was any connection. And I can't tell you how harmful that was. I mean, and luckily I had some additional background to this, but think about all the people, all of you guys that don't know that, right? So it's fine to work with another practitioner. Doing the brain pain connection code program is actually an augment, it's an additional thing that is helpful for you. The other question I get is, I don't know if my condition is a brain pain problem. Well, call me. That's why we got to set up a call. Go to the link, book the call, and I'll call you. And we do this over Zoom, basically. I can do a Zoom call. If you're in the US, I'll just call you. But if you're outside, in another country, whatever, we can either do a Zoom. Goal for you on the call is to make sure that, you are on the right path, you're on the right track, and that it is a brain pain problem and that you can get better. The other question that I get, let's see, medication. Yes. So of course, right. If you're on medication, like I said, please do not stop your medication. I will tell you, doing a lot of brain pain work, though, all of my clients, all of them have either decreased down their medications or they've gotten completely off, all of them. And I did that too. So that's fine. Just don't do it on your own. Okay. And I'm not going to treat that. I'm not going to, right. I'm not going to be practicing medicine in this brain pain program. It's just that, but I can guide you and I can tell you what to tell your provider or ask. And so again, that accountability, the accessibility to me is everything, right? Because I have walked this path. So I know you guys have spent a ton of money. You've probably tried all these things. Remember all that stuff. Doesn't matter because this is probably different. So if you need to discuss it also, people say, I have to ask my spouse, my partner, whatever, that's fine. You can still book a call with me because sometimes I want to know too, why you think it's important that you want to do this work, right? And sometimes you don't totally know. And if you don't know, then you might not be able to convey that to your family or your partner or your spouse. And I think that's really important. So again, I want to be of service to you guys. So even if it's that, learning how to, maybe approach a subject with someone that you need their support on because you're struggling, do it. Just let's book a call. Thank you. We did it, everyone. Thank you. Thank you. Thank you. It's my mission. It's my purpose, I think, to help you guys. And this helps me too, because it reinforces that, yeah, I did this and I know that you guys can do this too. So again, if you book the call, I can see some of these little things coming up. I can't wait to talk with you again. Thank you so much. Either way, I hope that you guys got a lot out of this. I hope that it changed your mind about your pain, and I'm really looking forward to working with you more. Thank you, everyone. Just pure heart, and I hope that you guys all have a wonderful day or night. Thank you.